Most importantly, I think, is if you notice any changes in your breast self-exam. If you notice a lump, if you notice the change in shape or size of your breast, if your nipple goes in, if there's a discharge, if there's redness, pain, swelling, any change in your breast that seems unusual is worth mentioning to your doctor. The proper exam should be done in 2 positions. What does that mean? That means you want to do the breast self-exam lying down, but you also either want to do it in the sitting or standing position. You want to use 2 to 3 fingers, and you want to start at the top part of your breast near your collarbone and basically work in a circular motion, pressing down firm enough so that you can feel the breast tissue, but not so hard that you hurt yourself. Breast cancer is a little bit different in that it has a stage 0. And what that means is there are cancer cells, they're contained within the ducts of the breast. They have not broken out of the ducts. Stage is how far the cancer's progressed. We have stages 1, 2, 3, 4. Stage 1 would be the earliest and means it's spread the least once it has the ability to spread, and it usually means it's contained within the breast. Stage 4 means that it has spread to other parts of the body. So first mammogram should be somewhere between the ages of 35 and 40, and then at 40 annually thereafter. There are some exceptions. Women who have a family history of breast cancer should begin their breast cancer screenings 10 years before that first relative was affected. So if you have a sister who developed breast cancer at 36, then you actually want to begin mammograms at 26. Your biggest risks for getting breast cancer are being a woman and getting older, so we all are. There are certain factors that of course increase your risk, one of those being family history, and that's the one that everybody thinks about. But most women who get breast cancer have no family history. So risk factors, now we look at lifestyle. We know that if you eat a high-fat diet, if you're overweight, if you consume alcohol, if you smoke, those increase your risk of getting breast cancer. Men do get breast cancer. It's a lot less common, but it happens. Whether you're a man or a woman, in most cases, breast cancer is treatable, and I've been in practice over 20 years now, and most of my patients are still alive today. Early detection is key because we know the sooner we find it, the sooner we treat it, the smaller it is, the more contained it is, the better your chances are survival. For a woman with stage 1 breast cancer who undergoes treatment, her chances of survival are greater than 95%, and often it can be as high as 98, 99% depending on the type of breast cancer. So typically a biopsy done from imaging is a needle biopsy, and that just takes a little piece of the tissue, and that's usually done either in the doctor's office or in the breast imaging center. Once it's diagnosed, typically the patient will see the surgeon first, but it is a team approach. So the surgeon will sit down and talk with you about your diagnosis, reviewing the pathology report, types of surgical treatment, the role of radiation and chemotherapy in your care, and then discuss next steps.